All right. So for this part of the exam, we have the tweezing and waxing. So before you start the actual procedure, they're going to tell you you have 2 minutes to set up the supplies for the hair removal of the eyebrows by tweezing and using simulated soft wax section of this examination. Please do not begin any procedures until the verbal instructions have been read and you are instructed to begin. Step back to indicate you have finished. You will have 2 minutes to set up the supplies for the hair removal of the eyebrows by tweezing and using simulated soft wax section of this examination. Please do not begin any procedures until the verbal instructions have been read, and you are instructed to begin. Step back to indicate you have finished. When they read this portion of the exam, you're going to hit that hand sanitizer. You do not have to disinfect. You do not have to disinfect your station, clean and disinfect your station. You go directly into your kit after you sanitize your hands. You take out your hair removal bag. And I'm just how I am because I've been touching that zipper. I'm doing this. I sanitize because I touched that bag. And then I can just remove my products, my supplies out. Okay? Where does this go? Okay. I have my tweezers.
Does it matter what kind of tweezers you use for the exam?
It does not.
Do you have more base in there?
I did not mean to have this in here, y'all. I was supposed to be, did not mean to have it in here. Did not. I took that out. I did not mean to have it. It was supposed to be labeled something else. Nope, it won't. Where did this go, y'all?
Trash.
That's why I couldn't find it. Because I did not want to be putting it really in there. Ooh. And then I'm just going to come in here and take out these guys. And I'm taking everything out. I ain't saving it. Because I'm about to use it. You better, then I'm going to count those out for you in a minute. So, I have...
No, they say alcoholic.
You said alcoholic pad.
And by this time, y'all ain't thinking about packing. Y'all already have gone through the packing video, and you kind of already know. And I'm holding this up, y'all, because my thing ain't low enough. All right. So I have 2 minutes to set all this stuff up. Now, I'm not working on my client. I'm not putting I'm just setting up my supplies. I'm just taking everything out that I need. I know I'm doing tweezing and waxing first. So I'm taking out what I'm using for tweezing and waxing. And you can't label this, but I'm just kind of helping myself out. Okay, I'm just kind of helping myself out because I know. I'm just going to kind of put my stuff out here. This is what I'm using first. So I got this by me first. Okay. So I know I just set up my tweezing and waxing supplies closer to me because I know the tweezing supplies because I know that's what I'm going to use first. So in that 2 minutes, just get set up. If my time elapses, okay, after I set up for that 2 minutes, if the time elapses, then I stop where I am. So I might take out my bag, and in that 2 minutes, all I have, I might still have a bag still up here that I have not taken out. I stop when that buzzer goes off, and I step back. And then once they come up to me untimed, I can finish packing, I can finish unpacking. So this is the beauty in this portion of the exam. It is an untimed section. They only time you to set up 2 minutes. But outside of that, when you start actually doing a procedure, it is untimed. So if I don't have time to finish, it's all good. You do it before you begin doing your tweezing and waxing portion, okay? So I would stop here. Okay. After we set up for 2 minutes, then the examiner is going to read this information here. Then the examiner is going to say, you will perform the hair removal. Yes, you will perform the hair removal of eyebrows by tweezing and using simulated soft wax. You will demonstrate hair removal from one eyebrow by tweezing. You will demonstrate hair removal from the other eyebrow using simulated soft wax. You will be expected to follow all client protection, safety, and infection control procedures. You will be instructed individually by the examiner to demonstrate the tweezing and soft wax procedures. This is an untimed section. Do not begin to demonstrate the tweezing and soft wax procedures until instructed individually by the examiner to do so. We are going to read those instructions again. You will perform the hair removal of the eyebrows by tweezing and using simulated soft wax. You will demonstrate hair removal from one eyebrow by tweezing. You will demonstrate hair removal from the other eyebrow using simulated soft wax. You will be expected to follow all client protection, safety, and infection control procedures. You will be instructed individually by the examiner to demonstrate the tweezing and soft wax procedures. This is an untimed section. Do not begin to demonstrate the tweezing and soft wax procedures until instructed individually by the examiner to do so. What this means is that all of this section that we've done, the only other untimed section that we did was the Virgin Relaxer application. When we did the Virgin Relaxer application, that instructor comes over and watch that one student. They're going to do the exact same thing for this portion. We also did untimed when we did saturation for chemical wave, as well as demonstrating a test curl and removing one rod. So this is another untimed section. I still have, so before I get started, I'm going to stop. I'm going to sanitize my hands. You guys might already have on gloves. I don't. So I have to go in here and take me out a pair of gloves. For this portion of the exam, your client does have to have, you do have to have on gloves to perform. Anytime I touch myself or touch the table or anything, and before I go back in and touch my client, I always hit my hand sanitizer, okay? So anytime I go from doing any of this touching to touching their body, I hit my hand sanitizer. So after I have my gloves on, I just happen not to have none on, okay?
Now, as a real person, do you need gloves?
You do, for tweezing and waxing. I'm going to hit my hand sanitizer because I'm touching my client. And I'm going to apply my covering. You can decide if this is the best covering for you. I want to make sure that there are no hairs that can get in the way when I'm tweezing and when I'm waxing. If I apply my wax and hair's poking out, and when I go to remove that hair can get stuck and I might pull and yank my client's hair out. So it's very important that we make sure that we have the hair completely out of the face. Okay, that it's completely out of the face. I do take off points when it's still in the face, okay? And it's untimed, so they're watching me, okay? I touch my client's hair. Because I touch my client's hair, I'm going to hit this hand sanitizer before I physically go in and start working on their face. So it says now the examiner is going to come up to me as they're standing here. They're going to say, please demonstrate tweezing. Okay, so they're going to come up to me and say, please demonstrate tweezing. I just sanitize my hands. So now I'm going to first apply antiseptic. Okay, so I'm going to take my antiseptic wipe. And I'm going to tweeze this side over here. Don't ask me why, y'all, but I am. So I'm tweezing this, I'm cleaning this area off with antiseptic. With the tweezers, you only have to do the bottom portion down here. Okay, so I'm just cleaning off the area with antiseptic. With the tweezing, I do not have to dry the area. With waxing, I do. So for tweezing, I don't have to dry the area. I'm going to hold, I guess I should have did this other eyebrow. Can you see me? Can you see me? Can you see me? I'm going to take my fingers, okay, and I'm going to spread. And if you need to come up a little bit more, you can. I'm going to spread the eye, the skin with my fingers. I'm stretching it out, so I'm going to spread it with my fingers to hold it, what they say taut. To hold it tight, basically. I'm holding the skin so that it's not, when I go in with my tweezers, that it does not begin to pull the skin, okay? So I'm going to hold it, and then I'm going to take my tweezers, okay? I don't know if y'all can see that on that slant, and I'm going to go in, and I'm going to begin to take the hairs and pull in the growth, not against the growth. When you're tweezing, you want to pull with the growth of the hair. So I'm going to hold the skin tight, and I'm going to pull the hair. I'm going to grip it with that little tip right there and begin to pull the hairs. Pull, 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 pull. Okay? Once I finish, so usually with tweezing in today's time, this is a follow-up. After I go in with my waxing and I still have hairs that are remaining, you can't go over with your soft wax 2 times. So I can only go over it once. So anything that I missed, I'm going to go in with my tweezers to fix. Okay, I'm going to go in with the tweezers to fix. So I apply the antiseptic cream. I have my fingers here. I'm spreading the skin tight, and then I'm going to go in and pull those little pieces of hair in the direction of growth. And you can come around, Tam, if you need to see this. Can you see it? So my finger.
Question though. Do we start from? Do we do the whole bottom, or we just?
You only have to do at least 4. You only have to pull off at least 4 hairs. So when we do the wax, you're gonna see it has to be the entire length. For tweezing, we only have to do 4, at least a minimum of 4, like when I'm plucking 4 hairs out. Okay, so I hold the skin tight, 1, 2, 3, 4, because we would be cleaning up down here in this area down here. And then when I finish with this guy, I discard it inside my items to the disinfecting container. And then I can come right in here and apply antiseptic again. So I apply the antiseptic when I first started. I apply antiseptic, I tweeze, pluck about 4 hairs off at the bottom, and then I apply my antiseptic again. Okay, that's real life with your client. So whenever you guys are going in, I'm gonna take a little break. Well, not a break, I'll do it, because I know this is y'all's first time even seeing or hearing anything about tweezing or waxing. Whenever you're going in and you're trying to figure out what arch do I use, how do I tweeze, you know, what direction am I going? So I would have done a consultation with my client. I would have made sure they didn't have any type of contraindications like they had. We're using any type of like Accutane, any type of acne medication, because those are things that thin the skin out. So when you go into wax, that might be something that causes issues with that client, because it might peel the top layer of their skin off. So there'll be an actual consultation card or intake card that your client will fill out, that you're going to be asking questions that are going to deal with what the impact is going to have on the skin. Y'all are going to go deeper into this next semester.
What if they're taking off? Oh.
Yep, y'all are going to go deeper into, so there's a lot of different contraindications that we have to think about when it comes to tweezing and waxing or working on our client's skin, of medication they might be taking internally, that we have to think about. Do I do it now? Do I wait until a later period of time? But when they're coming in to get, and you're deciding when you're going to tweeze and wax, like the shape, you're going to consider right here in this area in front of the nose. Okay, you're going to take this guy right over here to about the pupil area, like halfway to the pupil area right in here. Okay, and then you're going to also have right in this area, so you don't want this area right here, you want your arch to be sort of kind of in this pupil area right here, where you can see your little, like right in this little area right here. Then when you come to the end, when you place your stick like on the end, you really don't want it to exceed past this area.
Your eyebrow to end at, right?
Yep, like right in this area. So those are little key things that can help to kind of decide where do I place my arch at. But of course, they will also be looking at the different shapes as well. Yep, and then on the end.
And then you got to base it off their face too.
Yep. So it's a lot of things to think about, and sometimes it's client preference. How do I mix in what they like with what really fits more of their facial shape? But a lot of times,
never really like go into the eyebrow, like
Yeah.
you know the integrity of the eyebrow. Just take get that
Yeah,
one.
unless this
Because we
one is right
we
there.
naturally have what we have.
Yeah.
I mean,
Yeah.
so-
boy, you hit that group like my mama age, mine. It was a crying shame. You talk about folks just taking the whole eyebrow and about drawing one on like it was ridiculous. We came from a generation with thin eyebrows. Then it came back cute.
Tail end of that.
You came at the tail end. So now what's cute now over the past like 10 years has been thick natural eyebrows.
Yeah.
So that's more, you know, you're gonna get that look.
Boy,
Boy, it ain't happening. But that threading will give you that. If you
I
get
love-
your eyebrows
I
threaded,
love
threading
it.
keeps it, just leave it so thick and so it's just
Yeah.
whoo. But anyway,
I would-
here we are waxing and tweezing. All right.
That's all I was gonna ask.
So now that we have completed, y'all gotta bear with us for this 9 minutes. Okay. Now after we do the tweezing portion, then we're gonna do the waxing portion. Okay. So for the waxing portion, they're gonna come up and say, please demonstrate. So after they say please demonstrate tweezing, then they're gonna say please demonstrate hair removal by waxing. Okay, please demonstrate hair removal by waxing. When you get ready to do that part, I always, every time I get ready to get started, hit that hand sanitizer. Okay. So
You're gonna wax on the other eyebrow.
Yep, so I just wax on this side, tweeze on this side, so then I'm gonna wax on this side. I should not see at this point because I've already tweezed. My tweezers are discarded. They should not be on the station at this point. Okay, so I sanitize my hands. Now I'm gonna come in and I'm gonna apply antiseptic. You can kind of, I kind of be all over the place, so my body is really not a good.
Actually, like I would have stood, if I was doing the left side, like you did here, I would have stood on the
On that side, your client, when y'all are over on the salon floor, y'all are sitting down. So my client is reclined. My client is actually laying back when you guys are providing this service. So they're physically sitting out and you're behind them, so you can rotate around your client, but they're laying down and you have one of the small stools and that's where you're sitting at. So you're kind of able to maneuver. It's not this field, they're not sitting up. Okay. So now I'm gonna come in. I'm over here just so I'm not reaching all over my client.
Right.
I do that. It's not a good thing to do, but but this is going to help me not have to reach all over my client. Tweezing, I've applied in the direction of growth. Not tweezing, but I applied the antiseptic in the direction of growth. Anytime we're applying things, I'm just doing it in the direction of growth. I'm not going against the skin and dragging it all over the place. So that's the things they're thinking about. Now I've gone and applied the antiseptic. This is one where I want to dry. Now for me in the salon, I will even use an absorbent pad, but I'll also go in sometimes. People have oily skin. I'll take a little bit of absorbent powder. So the brand that you use, a lot of times will have an absorbent, just like a powder, just to kind of absorb all the extra oils and dry the area off. Because this part is very important, because if you skip this part, when you go to lay your wax down, you put your wax down and you put your strip on, and you begin to, when you remove the wax strip, that wax is still going to be stuck to the skin versus the actual wax strip. So that oil will cause that effect. So you want to make sure that you're drying this area really good, whether it be with absorbent powder or just a piece of cotton. Today I use just a piece of cotton. Once I go in, apply the antiseptic, dry that area off, then I'm going to go inside and I'm going to test the temperature. So I'm going to take this guy and take the wax, and I'm going to put a little bit on my wrist. Okay, I'm going to put a little bit on my wrist. And then I want to take a strip, and I'm going to get this mess off my skin. I just want to make sure it wasn't too hot, because if it's too hot, that can burn your client's skin and it'll pull the top layer of their skin off as well when you remove this wax strip. So because I touch, so we want to make sure it's not too hot. So if I put it on me, then on this rough skin, I'm not going to put it up here.
That's not me right now.
Yeah, so that it's not getting on their thin skin. So after I touch my body, I'm hitting this hand sanitizer. Okay. But yes, but we're testing it on us in this area right here to make sure that I don't put this on my client and end up with yep, it's thicker. So it's all good. The temperature is good. I just sanitize my hand. Now I'm going to go in and actually apply this wax. When you're applying the wax and you're working with it, sometimes this is the consistency. After it's warmed up, this is the consistency. So when you dip it down, because I'm doing a small area, I don't need wax all over the stick like that. I only need a small amount. So I'm being mindful of how much I'm taking out. Scrape off the back so that when you go to apply, it's not getting all over the place. You can turn it around if it's a piece that's still hanging. Okay, bring it out. We're not blowing on it. That's why we test it on us, because we're not blowing on this with my germs, COVID, and all of that stuff. Okay. I'm going to come right down here and I'm going to apply. We're just going to apply for the exam on the bottom. And I'm going to smooth this guy the entire length underneath. The entire length. So make sure that when you apply it from here all the way to the end at the bottom, you have applied the product, okay? So from here to here that is applied. This is going in the trash. The difference with waxing, when I apply my product, I'm going to smooth in the direction of growth. Sorry, Miss Shannon, I got all over your eye. But I'm going to smooth in the direction of growth about 3 good times towards me. Well, this is just happened to be the eyebrow that I'm on. But I'm going to smooth in the direction of growth. But with waxing, I hold it tight, the skin tight on the corner, on the end back here. I hold that skin tight, and then I go the opposite direction, and then I apply pressure. Okay, then I apply a little bit of pressure down here. Okay, you're going to have excess wax. So I just fold it over, and I just remove a little bit of that excess wax off with my wax strip. Okay.
So you pull it against the hair growth.
Yep, you pull it against the hair growth. So that's how you'll end up actually pulling it out of the follicle. After I'm done with that, I'm not done. So after that, then I need to take, after I actually remove and apply pressure, I'm going to take my antiseptic wipe. Make sure that if you'll notice that when you do tweezing and waxing, there's sometimes a little bit of blood comes out. So when you pull that hair out of the follicle with some of that force, sometimes you'll end up with a little bit of blood. That's a blood exposure procedure. So just keeping in mind, you know, for real, it's a blood exposure. So I want to put my antiseptic just in case there's a slight wound there. Maybe it didn't bleed or anything, but the antiseptic is going to make sure that the area heals properly. And then I'm going to go in with my post-epilation gel or cream or product and apply it right in the area down here where I just waxed it.
So we do that, what if, you know,
If it's
you have to do the blood exposure, when does that?
on the mannequin, you don't have to do it, but if I'm in real life, I'm going to stop immediately. If I see some blood, I'm going to stop the service and treat that client's skin. I'm going to put me on some gloves. So that ain't going to change with a client injury. I'm going to still stop and put me on some gloves before I do any touching on my client.
Would you still add that gel afterwards?
So it depends. It depends on kind of what's going on. I'm definitely going to add my antiseptic. If it's kind of still red, I might kind of put a little bit of that product around it. But at this point, you got your bandage on. So I'm really not messing with that part no more. At that point, it's the blood exposure bandage. And then I can do, like, I might still need to do the top part of the eyebrow. So she has a bandage here, but I still need to finish my waxing. I might move up to the top and finish the top up. And if I need to do any tweezing down at the bottom, I'm going to tweeze the rest of the way. Okay, you see what I'm saying? Yeah. All right, so that's basically, once I put the post-wax gel up there, I'm basically done. I'm going to sanitize my hands and step back. Okay? So I think I was supposed to let y'all do it halfway, but I didn't. So we're going to just go